Hello, everybody. Nice that you're listening to us. I'm today with Dr. Semir Beyaz. We both studied in Harvard, and I was there a little bit earlier than him, so we didn't meet there, but we're in some sort of Turkish-American network. That's how I got to know him, and I would actually want him to introduce himself a little bit, how he started to do research in the States and why he stayed. I got an offer to stay, but I came back to Germany, and what his research actually is about.
Great.
Semir, do you want to start?
Yes, thank you Elif, for your kind invitation. So I'm Semir Beyaz. I'm a scientist at Spring Harvard Laboratory, where my lab studies the intersection of diet, stem cell biology, immunology, and cancer biology. And my journey coming here has been an interesting journey. So I was born in a small town in southeast Turkey called Samandağ in province Hatay.
Wow.
And I was always passionate about science, and that led me to pursue a Bachelor's of Science degree in Izmir Institute of Technology in molecular biology and genetics. Right when I started my bachelor's program in Izmir, I started working in the lab in several projects in the field of immunology, and that brought me to for a summer internship in 2008 to Harvard. And after that summer internship, I was really impressed by the scientific community in Boston, as you probably would remember. So then I came back in 2009 for a research scholar position, worked in bone marrow transplantation and clinical immunology. And then in 2010, I started my PhD at Harvard in immunology. Throughout my PhD, I did work on epigenetic mechanisms that govern immune cell development and activity. In addition to that, as an orthogonal project, I worked on understanding how diet and metabolism influences stem cell biology and contributes to risk of cancer. And then after I finished my PhD, I skipped the postdoc phase because I thought I was ready to start my own lab. And I came to Spring Harbor to start my laboratory in end of 2017.
Great, wonderful, wonderful. Good career so far, and I've seen you had a lot of prizes, and you got grants for research, so everything's going fine, I guess.
So far, so good.
Yeah, it sounds really good. And so do you, I mean, I know it's not directly your field, but do you want to tell us a little bit about Corona, COVID-19, the pandemia in the States? As maybe I can, first of all, maybe I should introduce myself. I'm the chief of a healthcare center here in Munich, Germany. We have neurology, psychiatry, psychotherapy, and psychosomatic diseases we're treating. We actually have thousands of patients because we speak more than 8 languages. Now we have a second center we opened a year ago in the center of Munich, and we have a lot of immigrants we're treating. I'm Turkish origin. I was born in Istanbul. I totally grew up in Germany. And then I went to the States. First, I did an internship in New York at the Mount Sinai School of Medicine. And then actually it was more adventure, and I wanted to get to know Boston. And I went to Boston and I fell in love with all the people there, the city, all the foreigners, mainly from Europe, who actually bring in all their money and brain to Harvard. And then I did my doctoral thesis there. And after that, I went, I did the Master of Public Health at the Harvard School of Public Health. And then because of family and private relations, I came back to Germany. I was offered to do a PhD, but I thought immigrating again because I was growing up as an immigrant in Germany. I'm happy about my life here. I'm in a good place and I do a lot of good stuff, but it was also a good life there. I had a lot of prejudices against the US, but I think, okay, Boston and New York is not the US. So, and with Corona, I'm trying to inform the Turkish public. I'm talking to CNN Turk and Haber Global and different broadcasting stations and trying to give them insight into how we manage COVID-19 diseases in Germany and how we go about Corona pandemia. And yeah, so I'm very interested in your insights about what's going on in the States. We're always very shocked about your deaths and what we hear in the news.
Yeah.
I think it's more what the situation is about now. I mean, it's now shadowed by all these protests after the death of George Floyd, which is horrible, the murder of this Black person. Maybe if you want to, you can also tell a few words about that. If you're if you're affected at all, if you see any protesters. I know we didn't have so many Black students in Harvard, which was also interesting. We had a lot of Asians, a lot of Europeans, affirmative action or so, I think they called it, but but go on.
Anyway, so for coronavirus, for the past 3 months, we have been in lockdown state in New York, which means that you only carry out essential activities. So for research, that has been as difficult as other workforces. So New York City, you know, like completely shut down for the past 2 months, except for the essential workers. That is now changing a little bit. They are trying to do a phase-by-phase reopening strategy, but keeping in mind the fact that easing the social distancing guidelines and restarting the person-to-person interaction may lead to a second outbreak. So these are still experimental processes. They will probably try opening certain regions and figure out if there is an increase in disease spreading. And now things are hopefully we'll get back to a semi-normal state, or we will redefine what normal is, because the virus doesn't care if, you know, we cannot do our experiment or people cannot go to their work. Virus is gonna spread. So that's one part of your question. The second part is about the racism and the issue with George Floyd. So I condemn what happened to George Floyd. It is, I think, horrible. It doesn't fit any humanitarian value. And of course, that sparked a lot of fury and anger in many communities, because that has been going on for a very long time. Like racism and discrimination is a big problem in US and in the world as well. Like every country has its own discrimination and racism issue. It seems to me that some of these racism and discrimination and ignorance aspects are kind of like a hidden virus infected the system, and the system still has that virus. So in the protests, there are lots of peaceful protesters that are not doing any of these looting actions. So you may see in the news that, you know, like certain parts of the city, that should not mix the message that we need to learn from this situation. This situation shows us that we need to act together against racism and discrimination. And that's where I stand as an immigrant in the US, right? Because sometimes we are subject to racism and discrimination as well, because the way that we look or the way that we speak. But we need to, work together as humanity, irrespective of our race and background and gender. These are fundamental values of being a human.
I mean, I grew up in Germany, and I know here there is still some sort of institutional racism, or discrimination. I know I had very good marks, but I couldn't apply for certain grants because I didn't have a German passport, and I mean, it was difficult as first we were called guest workers. I was the child of a guest worker, so we were probably supposed to leave after a while. And then my father actually just came for a year, and since 1963 he's here, so he just didn't leave. And so now I feel that I belong here. I feel I'm German, but I also have this great Turkish heritage in me, which is important, and I try to really foster it. And I also feel a little bit American because I've been there for 3 years and I follow the politics. I think you have a very weak leadership or a wrong leadership, whatever you want to call it. When I was there, we didn't have 9/11 yet, and I had the impression that the US is much nicer. There, it's always about performance. If you do your job, if you're a good working citizen or a foreigner with a working visa, it's fine. So I even found it easier to be there than in Germany, because here you always have to explain why you don't look Turkish. I don't look very Turkish, and why you speak German so well. But in the US, they just take you as you are. That was my impression. But I think things changed after 9/11 and several other events. His officer, he was already investigated like, I don't know, 15 or 18 times before, and nothing happened. So it was clear he has a misconduct in treating people he's arresting minorities or blacks or whatever. I mean, I guess blacks are not minorities. I was at a conference in Philly, and I think there blacks are more than whites.
So the system in the US has been white-centric, right? Like the big white people came from Europe and became the founding fathers, but there were African Americans that built that country. There were Hispanics that were part of all the wars, all the processes these country had gone through. So these people were undermined.
Indians and
of
so
course,
on.
these people, or like all the immigrants that came. Like this country was built based on immigration, right? Even the first people who came, they were immigrants. So, so I think the discrepancy between who is in charge and who is in power versus who constitutes the country needs to be fixed, because so far only like white Anglo-Saxon and Protestants ruled that country.
Yeah.
Yet there were,
we say in Germany, over 50 white and male.
Exactly. So,
and
also
the women. I mean, there is a fight of women having the same possibilities. I'm a chief of a big center. As I know, there are not so many women, and probably not so many women with migration background who do this job. But I guess in other countries it's even worse for a woman who has a foreign background. But how about your research? I wanted to know, as far as I know, as a physician, it's the more greasy and fat you eat, the more cancer might happen in your gut. And but I wanted to, as a psychiatrist, obviously, I would like to know, do you have any insights into the how people feel about their, there is some sort of hypothesis going on, and people start to eat less of some foods and more of some supplements and say, I feel better and my psychology and my whatever sort of my fear is less and my depression is less. What do you think? Can you tell us anything about these?
Yeah, so this is a very difficult question. So like I want to tell you two things about that. One is the diet and disease studies should be evaluated with a grain of salt. Why? Because for studying the mechanism, you do experimental studies, right? You do studies based on cell lines and mice and maybe like a small cohort of human patients or human samples. But these are, you know, like highly controlled for any like variable that may confound the mechanistic experiment. So when you study the mechanism, you know, like focus on a very defined experimental framework. But what happens in daily life is very different than that. So assessing causality in humans, meaning that assessing what happens to a human in a human population of like 5 million when they eat fat, is a very difficult question to answer. However, this will be a step-by-step process where we do experiments in mice and in cell lines and in laboratory condition, and then learn from these mechanisms, and then validate some of them in some patient cohorts, and then learn from that, and then go back to the lab and do the experiments, and then learn from these experiments and go back to the clinic. Until that, you know, multiple iterations are done, I cannot give you any statement that if you eat fat, you get cancer. If you eat vitamin, you get no cancer. I mean, these are all
there's a big industry behind that.
And the reason
people really rip off others.
Exactly.
And I have so many patients, actually also a lot of Turks from Turkey who come with some whatever herbs and some vitamins and things, and then they say, you know, I don't want to take antidepressants, I want to take this and this and this, and then I will be fine. And I'm like, which research told you that this is going to be good? You're in a very bad state of mind, you should take this medication. But it is really interesting, especially in Turkey, there is like a big industry who's trying to sell people natural supplements whatsoever to sort of hinder them from taking medication against psychiatrists, diseases. I don't know if probably you have the same in the US.
Yeah, it's a global problem, I would say, and this stems from two things. One is circumstantial evidence. You know, people tend to follow things that other people say that, oh, I tried it and it worked. So this is less. I wouldn't compare it, but I would say it's more dangerous for diseases like cancer or more life-threatening conditions in which people fall into the trap of following some hyped up circumstantial supplements. It could be like a vitamin, it could be a plant extract. Dubbing it natural doesn't make it a drug. And so you know, like people condition themselves that this is going to make them happy or cured, and this conditioning may work for, like, I don't know, mood or some mood-based disorders, which are equally important. But there is a big danger in diseases like, you know, cancer or infectious diseases. I saw a lot of misinformation spreading around that, you know, oh, you don't need vaccine, you don't need social distancing, you only need vitamin C to protect against the virus. And this is like some doctors are giving that statement, and this is a disgrace, I would say, to
research. And
exactly. I mean, like there are some studies that can show that what vitamin C can do to a T cell line, to an immune cell on a dish. but that doesn't mean that, you know, like at the heart of a pandemic, you can make a claim like that, while we know that there are multi-center clinical trials showing that, you know, like some of these, you know, supplements, for example, vitamin D or vitamin C supplements, how do they help preventing diseases? Very, very little impact, because we know the mechanism of viral infection, right? And you are right. There is a $1 billion industry that's growing like a tumor around these, you know, innocent people, because these things are considered as generally regarded as safe, right? So you don't need to get an FDA approval because you're selling something that's kind of edible, that's like a natural substance.
Some herb or a supplement.
But those natural substances also can hurt you.
Exactly.
Yeah.
They can also increase your blood pressure or your heart rate, or and they are not so less dangerous than people think they are.
Yeah.
So we talked about your biography, about your research. We talked about your what do you think about Corona and COVID, what's going on in the US, and you're in a really, really bad hotspot. You're in New York, which is really dangerous. And now we also said a little bit about racism. What do you want to know about us, and what do you, I mean, we're sort of coming to the end of our very nice and very informative talk. What do you...
I'm very curious about, I see some conspiracy theory videos stemming from some German institutes and doctors, like some German doctor puts a, you know, like cameraman in front of him and says things about, oh, like coronavirus is not, you know, real. How can, you know, like German science institutes or like medical institutes act on these issues? I mean, we have the same issues in the US and in Turkey, but I was really surprised because I think German science system is all about like rigor and discipline, and I was really surprised seeing those you know, videos coming from like German doctors and scientists. So like I'm curious to hear your point of view as you lead you know, centers. Like, what's your take on that, and like what do you think is going on in the world?
I mean, there is actually one debate going on. There is one actually pretty good scientist, Professor Strake, who was also in the US and did HIV research. He came back to Germany, and there is a study several professors from Bonn did about a group of people that was one hotspot after a carnival feast, a big get together. A lot of people were infected, and then they decided, we want to have a look at Heinsberg. This is the little town where this happened, and a lot of people were infected. And this study was published, and they say more than 20% people are infected, but they don't know. They don't have symptoms. So they extrapolate, and they say it's 1,800,000 people probably who are infected, and not the positive cases that, for example, the Robert Koch Institute is saying it's 180,000 positive and 160,000 about who already are fine again. So it's about 90% who are fine again. So there is another number out there, and if you look at this number, and if you look at the death of 8,600, which is really not at all comparable to your situation in the US, you see that we only have, if that's right with this 1,800,000, then we have only 0.36% death rate. So there was a debate going on between the virologists who are obviously giving advice to Merkel and the government how to go about the regulations, and so this is one thing. But I think this guy and the group of professors, it's not just Streeck, he's the one who's always presented on TV because he's a very good talker and he can face criticism. But there is another group of professors, they are mostly retired, honestly. And they say, you know, coronavirus, we know that for such a long time. They really don't look at the new one, who is totally different, COVID-19 disease, as with another more potent virus than corona was supposed to be before. And yeah, so some maybe want to be heard, although they're already retired. I don't know exactly what that is about. But the thing is that we really have rather science-driven discussions. And we had protesters. This was really a horrible thing. We had protests where we had the Jewish star, you know, from the Third Reich, where people had to show they're Jewish, and then they would put that on their T-shirts and write on it, not vaccinated, and compare themselves to Jews being prosecuted by the Nazis when they don't take vaccines. First of all, we don't even have the vaccine yet.
Yeah.
And we don't have an order that everybody has to be vaccinated. So we don't have any regulations yet, but they still use it to, yeah, whatever, feel themselves important, or to put some pressure into the system. I think it's also driven by right-wing and very left-wing political groups who just want to disturb the order. And we are surprised. Merkel, a female leading this land, and as I think it's 8 other or 7 other nations who do a really good job in managing coronavirus, and they are all led by females. And Merkel, it's her specialty to not even mention these protesters. She just doesn't care. And she just sticks with the rules, and she tries to, you know, look at all the states. We have different states. Some say we don't want to have any regulations anymore. We don't have many infected diseases. Others say, okay, we have a lot of infections. We have to still, whatever, keep the restaurants closed, and cinemas and theaters and so on. And they try to always have a common sense. And actually, we have a lot of Turkish immigrants in Germany, nearly 3 million people from Turkey, and they want to go to Turkey for vacation, and they, you know, want to be more free again. They want to get married and have their typical big feasts and big parties, and that's a discussion going on. What can we do? What is the new normal? I don't know if you even talk about a new normal. I think you didn't even reach the controlled state of pandemia yet. Nope. So we have a controlled state. We have a R value, which is lower than 1. And that's a thing. We now allowed, such a test is quite expensive. And we are now allowed to test people who don't show fever or coughing or any other obvious symptom. And we can test them. The test costs about 120 to 150 euro, I think. We are collecting all the negatives. We are trying to have big samples. In Germany, we can have 800,000 testings in a week, and we managed to do about 400,000 or 350,000. So this is how we try to work with it, and try to, stay calm and focused, and look at the numbers, and try to reduce the regulations step by step. That's what the country is trying to do.
Great.
So, what do you do in your free time? How do you even have free time?
I mean, not much, but I live
Do you have family
off
and
the
kids?
city, so we have a nice beach here. I have a dog. I take my dog to the beach.
Right.
We have summertime. We have a garden, so I do gardening. I like cooking. Being from Hatay, as you may know, we have a good
And
cuisine,
probably
so,
spicy food, very
yes,
spicy food.
yeah.
Right?
I make kebabs. So I think most of my time is immersed with science and the lab, and in the free time, I like to do those things.
So you're happy there. Are you
Yes,
already
yeah.
an American citizen? Or are you?
No, not yet. I'm still an immigrant, a proud immigrant.
It's interesting. Yeah, I still have contact with friends who stayed in the US, and yeah, it's there are pluses and minuses everywhere. And
Yeah.
so, do you visit Turkey a lot? I mean, do you go back
I
and
try to
forth?
go. I mean, now with coronavirus, I don't know when next I will be able to go, but I try to go as many times as possible.
Your
I
family
visit
is back
yeah, my
home.
family is still in Turkey, so, and I miss the food, most importantly. So I try to go at every occasion, and also, I visited several times for like meetings and conferences. I have good colleagues in Turkey. We still, are in touch and try to do things together. Yeah, so that's all about it.
Yeah, nice. It was very nice talking to you.
Great,
I think,
thank you.
yeah, it was a pleasure. And if you ever make it to Germany, to Munich, please come visit us.
Maybe they can do virtual Oktoberfest, like ship the beer beforehand, and everyone can join on Zoom.
Yeah, Zooming is a big thing now, as we see. So
yes,
it brings us together. I would have never done such a talk before Corona, so it's interesting. It was a pleasure. I hope we meet sometime. Have a good time, and see you. Goodbye.
See you. Thank you.